This is my journey. Inspired one story at a time, a library of leaders was created. It began as a journey to learn. As time went on, it began to grow. All it needed was a platform, and this podcast was created to listen, to inspire, to share. I am a storyteller, and this is my journey. Welcome to another episode of Profiles in Leadership. I'm your host, Steve Anderson, and today our guest is Dr. Amy Loden Tiffany, who empowers high-achieving women to build thriving businesses and joyful lives without sacrificing their health, values, or family. Combining clinical expertise, entrepreneurial experience, and professional coaching, Dr. Loden Tiffany helps purpose-driven women break free from burnout, clarify priorities, and lead with clarity and confidence. Her work moves beyond time management to focus on managing energy, mindset, boundaries, and hormonal health, allowing women to create success on their own terms. So, Dr. Tiffany, welcome to the program.
Thank you. I'm delighted to be here.
So, did I say that right? Is it Dr. Loden Tiffany, or is it just?
I answer to all. I even
Okay.
have learned that Dr. Amy is what a lot of people call me. So however and whatever you want to do, we'll work with it.
Okay, let's go with Dr. Amy. That's great. So let's just jump in, give us a little context here. Where'd you grow up, and
Yeah.
what interested you in medicine? And let's talk a little bit about what you're doing now too. So go ahead.
Yeah, I grew up in Southwest Missouri, right in the middle of the country, and my parents were both veterinarians, so I had an early age and exposure to the idea of medicine. Applied to vet school, but was struggling with this whole concept that I'm allergic to animals. So it seemed like
Okay,
taking care of people might be a better option for
that
me.
would be tough.
It would have been. And, I really think that was the right decision. Early on, I was involved in some of my volunteer hours and watching heart disease, it really devastating, right? And we know that globally and in the United States that it kills both men and women more than anything else. And so when I'm shadowing this surgeon early in my career, I was just stunned to see how the heart worked and how amazing it was. But then when I go to college and medical school and find out this is the leading cause of death, I was like, what are you talking about? Like, why? This is such a disconnect. Why can we not do better? And really never saw myself doing what I'm doing today. I thought, I might be down a road of cardiology, but what I really loved about veterinary medicine is the same thing I love today, is let's prevent, let's be proactive. Let's take the science that we can't necessarily label with a number, but can make a difference in someone's life. And part of that came from a learned experience, my own experience as a patient, wearing a patient hat, dealing with that whole healthcare system that we all love to hate on, greatly understanding that if I had a heart attack, they'd be amazing. But when it comes to preventing heart disease, we don't do a good job as when I wear my physician hat to help patients avoid things. And I can promise you, I would bet money on the idea that if I told somebody you have to take a statin, that they would much rather do anything besides take a statin, right? So rather than fight that, why not figure out what is important to people? How do we prioritize the values that they want? And how do we help them build the lives they live without increasing the risk and still using all this data from science? So that's kind of the trajectory over the last 20 years of how I ended up in this role. On a personal note, cardiovascular disease in women is predicted by pregnancy and by menopause and has been ignored forever by the healthcare system. And I didn't really understand how big this gap was until I nearly died in my third pregnancy. And I had severe preeclampsia. My boys, I had twins at the time, and they were born 3 months early. They were in the NICU for 11 weeks. And it was so traumatic to me on a patient level, but also on a physician level, because after the babies were born, all the attention goes to the babies, right? And the more time I had to study what went wrong with my pregnancy, the more I realized preeclampsia was predicting I was going to die before the age of 60 if I did nothing different. It was a warning sign. And so many women have preeclampsia or blood pressure problems in pregnancy or gestational diabetes and don't realize how that's predicting their health, their future, and neither do their doctors and nurses. And so my passion is to get this information into the hands of the people who can do something with it, which is the people affected by it. I
Yeah.
can't make you eat better, right? I can't make you exercise, get better sleep, but you can. You get to be the charge of that because you're the expert in your life. So we partner with women, especially who have had menopause, perimenopause, postpartum issues that are really just otherwise falling in this black hole between OB care and long-term primary care. And we get to see their outcomes difference. And I truly believe we're saving lives because we're identifying these things early, we're getting them on the right track to prevent and to turn their lives around. And when you do that for mom, you do that for her partner, her husband, her spouse, whoever, you do it for her children, you do it for her community. You have this expanded ripple effect because what mom does is what everyone else is doing.
So do you have then do you is your approach as a medical doctor or
Hmm.
a health coach, or do you see that as the
Yep.
same? So if a woman was going to come see you,
Hmm.
is that through the medical system, or is it more
Yes,
through? Okay,
yes. No,
okay,
my role on the team is definitely working through my medical education.
okay.
So I'm trained as a physician in internal medicine, and I specialize then as a certified menopause practitioner as well as obesity medicine. So we're taking primary care and up leveling it so that these women are having much, much better personalized primary care experiences. We're not taking her away from her GYN. We're not taking her away from whoever else she's involved with, but we're saying, let's do this experience much better for you. And then you can take that impact and multiply it in your community. We do have health coaches, we do have nurse practitioners, and we have other people on the team as well. But the most important player on our team is our patients.
So, and that is what is, I think it's called Vert Vitality
Hmm.
Medical, which is
Yes,
your company.
yes.
So, is that a part of a bigger system, or is that your own entrepreneurial medical practice?
It is my own, and it is part of a system yet to be created, right? Like, we're going to talk about the future here.
Yeah.
This is too important to not let more women have access to it. And so we started in a very localized place here in St. Louis, and we're spreading out to the people who want this type of service. We offer it. We certainly have to deal with state licensing laws and telehealth laws and all the other things. So it's very complex, unfortunately, for our purposes today, but it is possible that we can help many more people than we currently do in St. Louis.
And are your patients or clients, however you refer to them,
Mhm.
are they exclusively female?
No. So the
Okay.
funny thing is probably 20% of my patients are men, and almost universally they are with us because their wife, sister, mother, daughter twisted their arm and made them come see us.
Okay,
But
good.
we do see men because as an internal medicine doctor, I'm trained for all, men and women. So it is definitely not exclusive to women, but probably 80% of our patients are women.
Okay, so we'll get more into that as we go, but I also wanted to reference that you did a TEDx talk, which was
I did.
impressive. And so, how did you get on that TEDx stage, and
Mhm.
what did you learn from that?
So I knew I wanted to share the trauma I had experienced in a positive way. And I, since the age of 4, have had a difficult time shutting up. So it was very easy for me to know I was going to be speaking it. And I really wanted to get this idea out to as many women as possible, not just in the US, but across the globe, that there is something that can be done. If you've had preeclampsia, preterm birth, if you've had gestational diabetes, we can do something about that, but most doctors and nurses aren't trained to do anything about it. And so if you just know you can do something, suddenly you start to look for opportunities of how do I do something? Who do I work with? What do I need to change? And that's the impact I was hoping would happen in a ripple effect for women globally. And I will say it is probably the scariest thing I've had to do professionally because you're standing on this stage and you don't know how people are going to accept you and you don't know what's going to happen on the internet once this is posted. But I have zero regrets about doing it. Absolutely glad to get the message out there and help advocate for these moms.
So this falls into the category. I'm in healthcare myself, and it's people refer to it like healthcare 3.0.
Hmm.
Like you're doing things for your patients in a preventative way or a health conscious way, as opposed to now that they have a disease, now what do we do? And
Exactly.
so, tell me a little bit about your approach to that, and how do people know when to come to you if
Hmm.
they don't know
Yeah.
they have that yet?
So my approach is playing the long game. Just like you would with your financial health, you plan for the future. And so I try to reverse engineer a future that we want to create. So what I commonly ask my patients is pretend for a minute you're going to live to be 90. And half of them are like, oh my gosh, I don't want to be 90. And I say, why? Why do you not want to be 90? And it's typically because I don't want to be decrepit in a wheelchair, dependent on others, having lost all my independence, my memory, whatever, right? What if 90 was you hiking across Europe with your great grandkids, though? What if 90 was going and doing all the fun trips that you've always wanted to do? Would you want that at 90? And universally, they'll say, oh, yeah, of course. And the difference between those is the habits for the last 4 to 5 decades.
Yeah.
It's what you did with the age you could have done something. And that's in your 30s, 40s, 50s. Most of the time, that's when you have the longest runway to make a meaningful change. And so for me, it was how do I reverse engineer the future that everybody wants, but nobody feels like they can get or have access to, and opening that opportunity up. So in our clinic, what we do is we certainly do the wellness visit that everyone knows they should go get their quote physical. Not everyone does it, but people know it exists, right? But why is there not a priority on this? And part of it is because it's very difficult to quantify and understand how much money is saved or how much health is saved from preventing things that never happened. They didn't exist. They don't exist because you changed what led to them. So if there's no money there, why would we put a lot of time and effort as a society into it, right? Counterintuitive, but that's the argument. And we
Mhm.
see that that's the right business argument because that's what business is doing. Business is following where they're going to make a profit. I'm challenging the system to say, look, maybe we can't measure how much we can prevent, but we can certainly measure how well people live based on the changes that we see. So we are regularly working with people to reverse diabetes, reverse prediabetes, improve their insulin sensitivity. We're working to reverse fatty liver and improve chronic kidney disease. Not all of these are 100% related to lifestyle and habits, but many of them are heavily influenced by them. And so if we can take that step back and start to reset people's bodies, well, suddenly we've saved money. We've saved the test that didn't happen. We can't measure it, but we know it would have happened.
Mhm.
And it's inevitable that at some point this will be mathematically figured out. That's way above my pay grade, but that is going to happen at some point. It just hasn't happened yet. And so in medicine 3.0, the way I think of it is how do you prevent and then how do you reverse? So
Yeah.
I tell people regularly, listen, you have diabetes. My question for you is, do you want to live with diabetes or do you want to reverse it? Because if you want to live with it, I'll give you the name of any doc in town who does diabetes care. They can help you. If you want to reverse it, I will work with you because that is so much more fundamentally impactful than just sticking you on a medicine for life. That's the easy thing, right? I can prescribe a medicine anytime. But the hard work is being in the really the crux of each day and understanding what are the habits, what are the mindset, what are the decisions you're making, what are the restraints you're facing. If you're working two jobs and you're taking care of your aging parents and you've got your kids at home and you're just trying to survive, you can't even think about this, right? And so you have to figure out where are people at in their life, what's that little one change they can make, and then what can that change leverage and momentum for their health.
Are you familiar with the book Outlive by
hmm One
Tia?
of the best
Yeah.
books I've ever read. I read that book. I thought, oh my gosh, I'm reading my brain. Like, this is amazing to read this from somebody else.
Well, it
Um,
sounds like, you were on the same page because one of the things
mhm.
that he talks about in there too, which I think is very interesting, and you talk a lot about mindsets, and the mind
Yes.
is that there's so many people that we see, elderly people that spend the last 5 years of their lives doing nothing but just trying to live longer. But
Yes.
that 5 year period of living longer is miserable. So
hmm
you'd have to ask the question, so what's the point, right? So
Correct.
if you can, like you said, reverse engineer it to the point like, well, how do I do things now so that I don't get there?
Yes.
And perhaps those last 5 years can be joyful and fulfilling as opposed to going to doctor visits and going through horrible treatments and whatever just to live a little longer.
Yes. Yes, absolutely. And I think at the heart of what most people in medicine, I'm going to just focus on physicians for my purposes here today, but I've realized that there's a lot more than physicians in these conversations. But I think the way we're trained, we think about disease present, how do we treat? Not disease present, how do we reverse?
Yeah.
And I think that's a fundamental thing that has to change. And the nursing and the physician associates, I think there's different ones in those communities that are being more vocal about it too. And I think the chiropractic, there's other groups. It's not just limited to medicine as a traditional sense of who's a physician, right? There's
Mhm.
other people who recognize this. I've got people who aren't even clinically trained who recognize there's a better way forward, right? So this kind of transcends degrees and it transcends institutions and it becomes how do we help each other as humans and how do we move each other forward.
Well, I think it also looks, I don't know if looks is the right word. I think it's better approached from a physician perspective as well, because as you said, you have untrained people that use their personal experiences. They don't have the training maybe that a physician has, and so they're giving their opinion, their expertise.
Hmm.
But in the long run, if you can back it up with science and research
Yes,
and that type of thing, that's a whole different ball of wax. So I commend you
100%.
for getting out in that field, because as so many physicians and so much of our health experience is based on, now I have a problem, what do I do to take away the
Hmm.
problem, as
Hmm.
opposed to what can I do to prevent the problem.
Absolutely. And, he talks about in his book, I think what we broadly misunderstand, maybe even misrepresent as a profession is the fundamental role that insulin resistance plays and that you can do so much more about it. So whether we're talking about chronic kidney disease or fatty liver, prediabetes, high blood pressure, insulin resistance is linked to these. The evidence is emerging. It's not complete, so we don't know the totality of it, but there's more evidence every year. And he talks a little bit about this too, that this is the root problem: inflammation, insulin resistance. And those are not tests that are routinely offered to all people or that all people even know to ask for, but they are very inexpensive for the value they yield. And so we check those in everybody at least once a year, and we're looking for where are there signs that you can do something different? And maybe that something different is nothing more than a 10-minute walk after you eat. Maybe it's that simple. I think when people realize how much their habits play a role in their lifespan and their health span, it empowers them to make changes in those automatic behaviors. And that's empowering.
How many of your patients come to you, and I'm thinking it's not specific to women, but let's just talk about women for now,
Hmm.
that come to you with their symptoms are basically exhaustion and
Yes.
low energy, and
Yes.
they just can't get over the hump.
Hmm.
So when somebody comes in, first of all, do people come to you for that reason? Do they feel like that's okay to do that, or do they feel like
Hmm.
they have to have some disease process or something before they can engage you?
No, I think most people, because most of our referrals are word of mouth or they've seen us on social networks, they kind of know what we talk about and who we are. But I do think that's a really common problem. Some of it fundamentally is you're tired because you're not sleeping well, right? So solve the sleep problem. Don't be working on your email until 11 o'clock at night, right? And we've all done that, myself included. We all have things we know we could do better. But at the heart of what I see, a lot of it, sometimes it's strictly I'm postpartum and I've got a 4-month-old at home and now I'm exhausted. Sometimes it's my husband snores as loud as a train and I can't sleep, or the pet's in the bed. And sometimes it's just I haven't got hold of my mind and my ticker tape in my brain is just ranging. So they absolutely come, but what's driving their reason for fatigue can be so different. Sometimes it's they have a crappy diet and they're not absorbing their nutrients. Sometimes they have sleep apnea, right? So they absolutely do come with that. Sometimes that's the primary reason, but what we find often, we check in with our patients enough that this is something so many people have. What frustrates me, and this is again, this is systemic, this is not people level problems, but there's so many influences into what we eat, and what we eat plays a whole role in who we become, what we can do, from our productivity to our sleep to how we show up in our relationships. Everyone jokes about being hangry, right? It's not actually normal to be hangry, right? There's a reason that that happens, and that abnormality is that is a sign of an abnormal metabolism that we need to address. But we blow it off in our culture. Like, I'm not sick enough. I'm not dying, so I'll just power through.
Right, and how do you manage expectations? I know a lot of
Mhm.
times people will go to a physician and finally make the appointment and finally get
Mhm.
in there. And the expectation is, give me a pill, fix this problem
Yes.
immediately. How do they
Yeah.
handle when you talk to them about you got to get your head out of the bed and you got
Mhm.
to do these things that don't seem medical?
Correct. So I'm going to answer that two ways. I'm going to answer it from my prior self 5 years ago, and I'm going to answer it from today. 5 years ago, as an internal medicine primary care doctor, I had about 3,000 patients. That meant that I was seeing patients for fewer than 15 minutes at a time, and I did not know who they were. I did not know what their life challenges or obstacles were. I didn't know what their options were for any of these habits versus medication. It was just churn and burn, right? Get through the day, go to the next 20 or 30 patients. I didn't manage expectations. I said, "Do you want a pill? No, you don't want a pill, go see a therapist," because that was all I could offer in that context.
Hmm.
In the business I created and what we do today, our appointments are 30 to 60 minutes long. I know my patients and I can say, gee, that stress you've been having at work recently has really started to affect your sleep. Let's talk about this. Part of our client experience is they have 20 coaching sessions a year with our health coaches. So they have that ability to build habits if they want. Not all of them take us up on it, but they all have that opportunity. So we have started really coming at, especially with new patients, but saying, what is, if you could wave that magic wand, right? If you could change anything about your health in a year, what would better look like? And we help them create a vision for what would be different. And we get really specific. It's not good enough to say more energy. It's I can get off the floor from playing with my kids. I have the energy to even play with my kids. It's that I can go to the conference because I'm not exhausted. It's all the different things that they want in their life, and each person's story is unique. So we meet them where they are, we define what success looks like, and then we work backwards to achieve it.
I want to get into more of that, but I have to ask this question
Okay.
too. So, will their insurance cover that type of care, or is this a cash-based business? Because we know how
Yep.
third-party payers and insurance companies dictate so much of that. Is it possible to come see you and get that level of care and have insurance cover
Great question. So it is a yes, no answer. First of all, it is our clinic is a membership-based practice. You are correct there.
it?
Do
Okay.
we take some insurance? Yes. Do I love that? Absolutely not. And in fact, I'm working toward a future where there's not insurance. I'm going to tell you why before everyone stops listening.
Yeah.
If I take your insurance, then I have to play by your insurance rules,
Yeah.
right? So it's actually less expensive to you if I don't take your insurance, because then if you have a copay or deductible, whatever, I don't have to charge you because I'm not in your network. If I take Medicare, then I have to play by Medicare's rules. If I take Cigna, UHC, whatever, I have to play by their rules. We're under a legal obligation to each other. The very presence of insurance, though, making decisions by forcing certain medications, certain tests to be done in a certain order, everyone hates that. Doctors and patients alike. We all hate it. We've all experienced it as patients. And I think there's a big misconception of how much control doctors have within the healthcare system. And I say that based on just my experience watching people get angry with me when medications aren't approved or they have to pay out of pocket for a test that we think they need. I don't control that. Either their employer does, the state exchange does, whoever they're getting their insurance from does. And I've heard it said, I don't know who to credit for this, but the idea being that we really should consider health insurance to be more as a catastrophic insurance, and it would
Yeah.
be less expensive in totality if we just paid as we went at the actual cost rather than the inflated prices that occur because of insurance.
So,
So
would your practice fall under the concierge?
yes,
Bill?
yes, we are a concierge model. We
Yeah.
did start with insurance, and the reason we had insurance and your membership, and the reason we did that is that's what our patients told us they wanted. But over the last 5 years, as we've watched this, it isn't good for patients. And the more we started having conversations with them about, do you understand this is, the outcome that's going to happen if we stay in network? They started saying, hey, we don't really care if you meet your deductible or not. What we want is good care. We want care when we need it. We want to know that we trust the people who are giving that care. And if that means that we need to go into this model, that's what we'll do.
So, not to belabor the point, but just
Yep.
perhaps for those listening that aren't in the medical field, I still have my Medicare or third-party payer insurance for if I'm hospitalized or there's
Yes.
a traumatic incident or some big medical expense, but I'm going to pay out of pocket in this membership system so that I can get the personalized and
Mhm.
care that's going to help me more. So you got to be willing to pay a little extra for that, but yet you're still,
Yeah.
it's not like you're going without insurance.
Correct. And actually, we tell people you need insurance, right? Because if you do need a medication or if you do want a test or a lab test, you want to run that through your insurance. And so it is, it's a hard conversation, and people say, well, this is so exclusionary what you're doing. And at a surface level, they're right. What I would offer is that when I had 3,000 patients, I capped out at 3,000 patients. Like I could not do more. And that was working 80 hours a week with 4 kids at home. It was awful. It was the perfect recipe for burnout. In fact, one night, my daughter came up to me one night and she said, Mom, why do you love your job more than me?
Oh God.
And I was like, I'm done. I'm done. That was January of 2021. I told my husband that night, she was 7 years old. Why do you love your job more than me? And I told my husband, listen, this isn't working. I can either retire, be a stay-at-home mom, do all the things that these kids need, or I can find another job, but this isn't working. And he looked at me with the most serious expression on his face. He's like, you are absolutely not retiring. You cannot be home all day. You have to go do something, figure it out. And
Yeah.
he's been like my number one fan and supporter of this because, we just took on a foster baby. I couldn't do that if I was working with 3,000 patients, right?
Yeah.
I couldn't we homeschool one of our kids. I couldn't do that if I had the restrictions that I did 5 years ago. So there are things that are exclusionary by definition. I also couldn't give back to the community the way I had. I couldn't have done the TED Talk. I couldn't have written the book, The Postpartum Pivot. I couldn't be putting out nearly every day videos on social media for people to learn and to grow and to better. I mean, the impact is going to be so much bigger than my 3,000
Yeah.
limit. And so there are things that it makes me really uncomfortable when I think about excluding people until I realize, hey, you're uncomfortable because you feel like your scarcity mindset, you're limiting this, but you're actually opening it up much bigger than you ever could have in the former model.
Well put. Well, let's quit talking about the ugly, nasty stuff and let's talk about the positive stuff. So, okay, now you're seeing your patients, they're coming in, and one of the things you said in the TED Talk was you're kind of breaking down this perfectionism mindset.
Mm-hmm.
So, again, I'm not trying to make it, women versus men or sexist
Mm-hmm.
in any way, but heard it be said before that women, are more this way than men.
Mm-hmm.
They want things to be perfect. And they're trying to make things
Yeah.
perfect, but
Yeah.
yet it's just not possible. So
Right.
that I assume it starts with just trying to have those kind of level discussions.
We talk a lot about our thoughts. And, whether you look at the scriptures, you look at positive psychology, you look at whoever source you want to, it's very clear that our thoughts make a difference. Thoughts become actions, actions become habits, habits, behavior, character, destiny. You've heard all the quotes, right? I really try to, at a high level, tell people we are going to make you uncomfortable. That is our job. If we're not helping you be uncomfortable, we're not creating change in you. And so when you come to me and you tell me that you've got all the things going on, that you don't have time to work out, that you don't have whatever, I'm going to push back and I'm going to ask you, is that true? Is that really true? And the reason I want you to be uncomfortable is because I want you to stop the automaticity of the excuse or the thought patterns taking you there. The only person who can't do something is the person who's dead, right? As long as you are alive, you can do something. I don't know what that something is. You're the expert in your life, but I can help you find it. And through really drilling down and breaking, the perfectionist mindset, breaking the catastrophic mindset, meaning that it's all or nothing. I either am perfect in my diet or all of it's thrown out and I eat whatever I want. Already screwed up today, might as well keep going. That's what I hear all the time. It's just not said like that. The food noise, and women tend to deal with this, experience this more than men, but the food noise sometimes is awful. And when we finally get it treated, they're like, oh my gosh, is this what normal feels like? I can get so much more done. And so figuring out what is the fundamental thought process that is here, what used to be good for them may not be good anymore. So if, I went through my 20s and I had a certain thought that empowered me, it might not empower me in my 30s. It might not be serving me as well, or in my 40s. And so really starting to drill down and asking, is that true? Really? Tell me why it's true. And almost always they catch themselves and like, oh, well, maybe it's not true in this part. Okay, let's explore that more, right? And as we start doing that one-on-one, really deep coaching, we see transformation happen.
That kind of patient physician conversations, you do not learn that in medical school.
Absolutely not. Nope.
It's
Uh,
yeah.
yeah. So I have done additional training both in health coaching and in life coaching. I also did a lot of psychology training through business school, actually, understanding what buyers are saying, what vendors are saying, and conversations within organizations. And I've always been drawn to this idea of how do we communicate better. And there's beautiful books. I won't even begin to tell you where to start there. There's so many good options. But what's really interesting to me is how not do we communicate better in totality? How do we communicate better for you at this stage in your life? How do we meet you where you are and empower and uplift you in that situation? Because I've had patients who've been ever since I moved to St. Louis in 13, they're still my patients. And so what they had and needed then is different than what they have and need today. So looking for what does each person need and tailoring it. Number one, you can't do that well in a 10-minute visit, which is what we're trained to do in medical school. And then number two, you can't do it well when you're not willing to put down the computer and look somebody in the eyes and understand what's going on. If you can't grieve with them, if you can't pray with them, like if you can't be that person with them, then you're going to have a totally different experience than what we're describing because that's what we're doing, meeting them where they're at.
Yeah. I remember a personal story. So I have a son who's a physical therapist, and in his early professional career, he told me once that he evaluated a patient, and for an entire hour, he did not touch or put his hands on the patient or do any
Yes.
evaluation things. And he said, I felt so guilty
Mhm.
charging that person for that visit because I didn't
Yes.
do anything. And I remember telling him, no, you should have charged them double because that's exactly what they needed. They needed to
Yeah.
tell their story. They needed to
Right.
be heard. They
Yes.
needed to have some, conversations. And guess what? Patient came back the next time without him doing anything and was better.
Yeah. It's amazing.
Yeah,
At a fundamental level, we all want to be loved. We all want to be heard. We want to be valued and respected.
yeah,
Right. And that was probably one of the things when we opened 5 years ago that I started hearing that I had never heard before from our patients. And I continue to this day. I hear it. Every new patient in some way says something similar. I just needed someone to listen
yeah,
to everything and tell me I wasn't all in my head. I'm not crazy. I don't need to be the unicorn, but I want to be heard. I want to
yeah.
know that my story was listened to. And sometimes I can't tell people, right? But I can hear them and I can give them the gift of listening for that time we have together.
So let's talk a little bit about too. You discussed setting boundaries and saying no.
Hmm.
Those are hard things to do when you've got
Yes.
pressure from family and
Hmm.
profession and
Yes.
careers and even social things. So,
Correct.
you know, uh,
Correct.
do you hear that a lot, and do you feel people don't know how to manage that?
I think it's hard to say no. We've grown up in a society and a culture where you're expected to do everything and be everything. And saying no is considered weakness or rudeness. You don't care. We tell each other stories about why that person said no. And I would argue that you can you can say yes to everything you want to, but you're never going to have a full yes that's meaningful to you if you do it that way. You
Mm,
need to start with what your values are, what's important to you, and understand that. And like that should be taught in kindergarten. My children can understand this. So I don't understand why we can't leverage this across all of education. But if you don't know what's important to you, how do you know when you get to where you want to go? How are you living your calling, your passion, your dream if you're following someone else's passion, dream, and calling for them, right? And so, what I think is really important to understand what is important to you, what are your values? And that may or may not be what anyone has taught you before. So for me, for example, faith, family, fitness, and that order, those are my three values. And everything I decide has to go through and show me how it's going to be aligned to that. If it can't do that, I need to say no. And practicing saying no is hard. In fact, my one of my 6-year-olds now tells me my superpower is saying no. And he said, I'll prove it to you. I said, what do you mean? He says, can we have a yes day? I said, no. So, you know, you do have to grow the muscle and it is uncomfortable, but it's supposed to be uncomfortable if you're growing. You would
mm,
never see a little kid learning to walk and falling down and be like, oh, you're not supposed to fall down when you're walking. So sorry. You would say, get up, do it again, right? You just haven't figured it out yet. Same thing with any new. It's supposed to be uncomfortable. You're growing.
yeah. You also talk about managing energy, to avoid burnout and avoid
Mm-hmm.
medical problems. So if I
Mm-hmm.
come into you and I just say, I'm so tired and exhausted, and
Yeah.
I have no energy, do
Mm-hmm.
you start with the medical workup, or do you start with
Yeah.
more of the psychological stuff?
So we screen everybody at their visits for any evidence of depression, anxiety, binge eating disorder, insomnia, any of the big things, because we want to know. We do a lifestyle intake assessment. What are you eating? How many servings of fruits and vegetables a day? How many servings of processed food? How many fast times a week are you eating fast food? Are you smoking? Are you using marijuana? What are all the things? Um, we could go a lot more. I mean, we could start asking people what their water filters were, but we're trying to hit the high level. What are the basics? And so it's nutrition and hydration. It's looking at their activity levels or inactivity. How well are they sleeping? How much sleep are they getting? Looking at their relationships. If you're living with a toxic relationship, especially if there's a violent relationship or an abuse potential, you can't thrive and heal in that kind of environment. We're looking at their spiritual health. We're looking at the emotion, mental, the whole thing. So it's a very large assessment we do at the first visit. And then we talk to them. I actually have my nurse practitioner come in with me. I want to have them tell everyone who's going to be clinically treating them what's going on. I think that shows them respect. I think it helps us understand them better when two or three people hear the same story, then we both or three know the patient better. It also empowers the patient then to talk to any of us and not just one of us. And
Mhm.
what we can do by these really early assessments is we can start to say, do we need lab tests? So, for example, I recently saw a new patient. She came in with fatigue. She's overweight. She's not eating well. She's trying to take care of everybody. She's not taking care of herself. And did we do labs? Yeah, because I need to know what inflammation you've got going on. Did we check her nutrients? Yes, I need to know. Tell me you're not eating well. Let's figure out what if there's a nutrient deficiency. Will I send her for additional tests like a sleep apnea test? Maybe, right? Like we go through the things that are reversible, fixable first. But many times those are normal. Many, many times there's normals. And then you have to say, all right, we've ruled out the scary stuff. Let's go deeper. And that's where we start to say, not just the general mental health screening, but the mindset. Tell me what thoughts you're having. What are the things that are leading you to say what you just said? And we, again, work backwards, which isn't unlike how doctors are trained, actually, right? People come in and they say, I'm tired. Well, what should you do? You look for the common things. You look for thyroid or anemia or kidney or whatever problems. But we can do the same thing at deeper levels. Just because I don't have a test for it doesn't mean it doesn't exist. It doesn't mean that the patient's making it up. So we keep going layer by layer until we find, and then we work on that, whatever we found. And sometimes this takes several years. And that's, I think, a very frustrating thing for patients. Who wants to feel bad for years, right?
Yeah.
But would you rather feel bad for 2 or 3 years and really get to the heart of it, or spend the rest of your life feeling like that?
Right. Again, you go back to expectation. You can't come in and
Mhm.
say, one visit, I'm going to be fine. It's
Correct.
something it's a journey and it's going to take time.
And I typically will tell people, how long have you been feeling this bad? Oh, 2, 3 years. It just keeps getting worse and worse. And I say, okay, it's going to take 2 to 3 years for you to get better. You just need to understand that. And if it gets better faster, you can come and tell me I was wrong. I'm happy to be wrong on these things, right? But that's not what most people experience. It takes as long to get better as it did to get unwell.
As you see this business years growing, do you anticipate adding more medical physicians or do you anticipate adding more health coaches?
Both. So I felt health coaching when I first heard about it, I had this really sweet little old lady. She was probably in her 80s, come into my office. It's when I had these 3,000 patients. And she brings me this letter from what looks like her insurance company. And it's like, we now offer health coaching, call, make your appointment. I was like, they are scamming this old lady. This is not real. I'd never heard of it before. So then I'm like all righteously indignatious, right? And I'm going to look it up and see what it is. And I fell into this whole world of health coaching. So I actually became a health coach and started advocating this to my patients. And then I brought on some health coaches. So to answer your question, it's not either or, it'll be a both and. We need good health coaches and we need good physicians and nurses and we need the whole team to work together. But it's too much for one person. And so if one of your listeners is a physician or a health coach and they want more information, they should reach out because I think as we continue to grow, it's only natural that we need all of this to expand.
Where does your passion lie with this is an entrepreneurial business,
Mhm,
doing things that is not necessarily common in
mhm,
healthcare.
mhm,
Are you excited about growing the business and adding more sites and building a business,
mhm.
or is it just better helping the patients that you're working with?
I want to die knowing that I made an impact in people's lives.
Hmm.
And so if that means that I have to hire other physicians who can do a better job than I could do alone, then that's what I'll do. If it means that we need to engage more health coaches, patients don't totally understand health coaching yet. It's just too new-ish to the conversation that many times I have to tell them, please just go for 3 sessions. Go see what you think. If you hate it after 3 sessions, I won't bring it up again. But I've had so many people tell me that I got more value out of working with the health coaches than I've ever gotten in seeing a doctor, a nurse practitioner, whatever,
Mhm.
because they're helping solve that underlying problem, which is a thinking problem. It's a habit problem, and they go hand in hand with the medical. We're taught in medicine how to diagnose, right, and treat, and we can tell you why something's going wrong. But when we tell you how to fix it, and then we say, bye, see you in a year, nothing changes because you
Mm.
don't have that accountability and support that a coach offers. So, yes, I want to create teams where we have physicians, nurses, and health coaches working together to support groups of patients. And that's not unlike what other people do. Where I think ours is different is we're really focused on women 35 to 55. We'll take care of other people. Don't get me wrong. I'm not saying they can't, but our magic sauce is for the 35 to 55-year-old woman, whether she's the CEO of her home and she's running the kids and doing all the organizational psychology at home, or running the corporation. That's who we help best. And part of that is because this is all lived experiences we have had ourselves. We get it. We all have young children. We are all trying to figure out, how do you do the work outside the home? How do you come home and do the run the home thing? How do you work with keep your relationship going with your significant other? We're all figuring it out too. And so just that really raw authenticity and vulnerability we try to share with people, I think, is what helps this be what it is. Before I got on this call with you, a woman said, you are literally saving patients' lives the way you're doing this. And that is valuable. That right there is valuable to me. I don't need a high salary. I don't need a fancy title. I need to know that I'm making an impact for somebody.
You mentioned in your TED Talk too, and you mentioned it earlier as well, that this mental clutter just steals clarity and energy.
Hmm.
So how do we calm the mind down? Do you go
Yeah.
into mindfulness training, things like that, or is
Hmm.
it just sometimes it's maybe just becoming aware of it and trying to do a few little things?
Hmm. A lot of women, where they find it is they notice they can't sleep well. They'll go to sleep fine, but then they'll wake up and the ticker tape won't turn off.
Mhm.
It's not the full-blown panic attacks or the Hollywood version of the overwhelmed person. They're trekking right along doing just fine. But then they can't go back to sleep and they're thinking about all the things. And that lack of sleep builds up, of course, and then there's other manifestations. But what we try to do is really understand, what does this look like for you? When is it happening? Because it can happen at other times. How is it showing up? Is it in your relationships? Is it in you not wanting to cook dinner, so you go to get fast food? Is it are you not outsourcing what you could? Um, a long time ago, an older physician told me, you don't need to clean your own toilets. Let someone else do that. Be patriotic, give them a job. I was like, huh, I never thought of it that way, right? And it's not that it's a better or a worse position, it's that it's the work that needs to be done, but do you have to be the one to do it? And when
Mhm.
it comes to energy management, I think it's really important that especially moms who work outside the home realize they have two full-time jobs, the one inside the home and the one outside the home.
Yeah,
And if
sure.
it was easy, everyone would do it perfectly. It's not easy. It is really hard because no one's supposed to have two full-time jobs, right? But if that's the life you have, then how do we make it work for you? How do we make it work for the kids, the people you love, the business you have, or the ideas you want to grow? So when you ask, how do you settle the mind? It kind of depends on what the mind is doing. I don't throw drugs at this. If somebody really comes in, they say, I need a happy pill, like, I'm going to explore that with them, but that's not my first line. I want to understand what's really driving this. And for some people, part of this is tricky because I have to be, and I want to be respectful of people's cultures, of their religions, of their family values. So it's not a one size fit all type of thing. And how I might counsel somebody who has a shared faith versus a different faith becomes real. And you have to go through that with them where they're at. So I'm not sure I can perfectly ask that for you, but I try to be truthful and transparent, and that's what I can offer.
Yeah. I identify as a storyteller. I love stories. So
Mhm.
without names, obviously,
Yeah.
give me a real life patient story of someone that comes to mind that came in this way and through your work you helped and now they're this way. Can you tell us one of those?
Yeah, absolutely. So it's been about 3 years now. I've been working with her year over year. Our health coaches have worked with her. We see her every 3 months dealing with it. We printed out her labs and showed them to her. And it was literally just a column of red from top to bottom. Everything was wrong. Red, 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 red. And I showed this to her and I said, listen, we have seen these labs be read for the last couple of years. Is this the story you want for yourself? Because the story right now has you on a trajectory of having a heart attack, having a stroke, and dying before you're 70. Is that the story you want, or do you want us to help you create a different future? And I recently saw her and she was in tears. She's like, I've lost so much weight. I have so much better control. The health coaches, she's like, if you thought they were my BFF last year, they're even more so next year. She even threatened to leave the clinic if I ever fired the health coach. I mean, she's more interested in seeing the coach than in seeing me, right?
Yeah.
But she was like, you saved my life because you printed something in red and you showed me that this story I had created for myself was going to kill me. And not everyone says it so clearly or understands it as dramatically as she expressed, but we fixed the story with cholesterol, with blood pressure, with weight, with her glucose. Every single thing was red. And now today, everything is in the normal range. And she's not on medicine for it. It's her habits, her mindset, her lifestyle that changed. But it took 3 years to do it, right? And so those types of stories happen every single week. And that's what fuels me to keep going. It tells me we're on the right track, that we can elevate the experience and then we can take those learnings. And I never tell people's names, but I will not infrequently talk about something that happens on social media and say, today I saw such and such, and this is what happened, because I want those shared questions. If one person's having that question, many more people are too. So getting the information out there into the hands of people who can use it.
I think it's so important to focus on what you said earlier and that it's a journey and that it may
Mm-hmm.
take years. It's so hard to look at something on the front end and think, you often get the question like, well, what am I going to be like if I do this for a year?
Mm-hmm.
And I'm
Mm-hmm.
sure you're in a position to say, well, I can't tell you, but I can tell you if you do these things, it will be different.
Right.
And then you go a year out or 2 years out and they say, now look back and we'll see what
Yeah.
you were back then. And
Yeah.
it's just mind-boggling. So it's hard to get that message because when you're at the front
Mhm.
end of it, it's like, well, how could I do anything more? How could I do anything different? I don't
Exactly.
have any energy to do that, which is the reason they're coming
Mm-hmm.
to you. So
Exactly.
that's a tough leap sometimes.
It is, and one of the ways that I think we meet people where they're at in that setting, because it's very real, is we tell them expectation-wise in our membership, you're gonna see us once a month for the first 3 months, and then you're gonna see us every 3 months. This is not the doctor's office that you go in once a year and get an employer form that you had your cholesterol checked. Like, this is the doctor's office where change happens, and when you can meet somebody that often and have those longer appointments, you're magnifying the amplitude and the trajectory that was already going to happen if they changed, and you're making it in a more compressed time period. So something that might have taken 5 years before can now take 18 to 24 months. And being able to do that, to leverage that person's strengths and their knowledge of their situation, is what makes the difference between what I did 5 years ago and what we do today.
When I think of people in this area, let's call them celebrity physicians,
Mm-hmm.
write books or on the speaking circuit or whatever, and they get a
Mm-hmm.
name for themselves. A lot of them now just have practices where they're, basically on telehealth. And they're
Yes.
basically, I'm going to pay you money and check in with you once a month or whatever.
Mm-hmm.
You see that as being a part of your practice at some point too?
Mm-hmm.
Are you going to try and do telehealth? Are you going to try and reach outside of your middle Missouri?
Mm-hmm. Yeah, it's a good question. I don't see it while I have a 4-month-old. Let me put it that way. We have 5 kids. The youngest is our foster baby, and she's 4 months old. And
Right.
right now, my passion is in helping her have the best start to her life as she can have. And if that means that eventually she goes back to her family, that's wonderful. If she's with us, that's wonderful, right? Like, whatever her story is, we're a part of it today, and we want her to have a better chance. And when it comes to the celebrity walk, I don't know what God wants for futures, right? Like, I can't predict that, but I can tell you I'm going to walk through every open door that appears to me. And if somebody asks me to be on their TV show or their radio station, why would I say no? That just means more people get to hear how they can transform their lives. And if I have something that is so good and so amazing and I don't tell people about it, that's really wrong and mean for me, right? Why would I not share good news with people? And so if I figured out that insulin resistance is what we need to target and how to target it, then I'm going to share that. And maybe that means that we have company that grows across the country. Maybe it does mean that it's more virtual. What's interesting that you asked that is we already are 70% virtual because our patients are so busy and they travel for work and they need somebody that they can do a virtual visit with. It's one of the reasons I left formal medicine is they weren't interested in telemedicine. And it was like, wow, really? And then COVID happened and everyone got real interested in telemedicine. And it's just for us, we never let it go because we think we can literally, somebody will be in the car telling me about their UTI symptoms. And it means they don't go to urgent care, they don't go to the emergency room, they just go to the pharmacy and get what they need, right? Or they're traveling. And a lot of people do have the luxury of being in different states at different times of the year. And so maybe they're not in Missouri part of the year. And so being able to help them and them not having to have two different experiences, those are all added value. But, value is defined by the person who's experiencing it, not by me. And so I don't know what that looks like yet.
It's so interesting you bring that up because, again, in my physical therapy world, it was like before COVID, every conference you'd go to, all you could hear about is, the future telehealth, and you can see patients over Zoom and you can do this, and everybody talked about it, but nobody could figure out how to do it. Then COVID comes, and within a week, everybody
Uh-huh.
figured out how to do it, right? So
Yes.
they were doing it, it was going great. And then, unfortunately, because third-party payers decided they didn't want to pay for it as much anymore,
Mm-hmm.
then
Mm-hmm.
everybody went back to not doing it. So it was one of
Right.
those things that just, yeah, I think people appreciate that. And I know from just a patient perspective, if I can communicate with my physician over a portal,
Mm-hmm.
if I can get my physician once in a while on the screen, and I
Mm-hmm.
don't have to go in, that's a big bonus for me. So
Yeah.
I hope we go more in that direction where we don't have to go and sit in the waiting room and wait
Right.
for the physician to be behind and
It's
or
awful.
yeah,
I
so
hate it.
hopefully,
As a physician and a patient, I hate it because, some of my colleagues were really good at this, but it stressed me out to no end to be late. And you were always late. So I mean, I don't know how they do it. Maybe they don't tell me that they're stressed out about it, but no one likes waiting.
yeah. Well, and it does. It puts pressure on it, and as you know, you can patient sense when their physician is behind, under pressure, and almost thinking of the next person down the road, and they can.
Correct.
So
Correct.
no wonder so many people say, well, they just don't take the time, or they don't listen to me, or there's not
Right.
time,
Right.
or I walked out of the office and there's three things I was going to ask them, and I
Mm-hmm.
forgot. You know,
Right.
so yeah, the
Right.
system definitely needs to change. So I commend you for trying to make that happen because it's not easy because you're bucking the system, but yet
Yeah.
it sounds like you're seeing positive results, which gives you motivation to keep going for sure.
100%. And it lets us be creative. We now offer longevity assessments. That was nothing I learned in medical school, but it's just putting pieces together and realizing, hey, if you have insulin resistance today, you're going to have a problem tomorrow. If your grip strength is weak today, you're going to have a problem in a decade. Like that is truly predictive to me. Why wouldn't we give people that information? How wouldn't we want them to be reversing that? And it can be done with non-medication options. We use meds, they're a tool, but they're not the be all end all.
If you were to go, you've probably been asked this a million times, but let's say you're the dean of a new medical school,
Mm-hmm.
and you're going to put together a curriculum that you think is
Yeah.
the best for these future physicians. What's the one thing you're going to change and do in that medical school that's not being done now?
So right now, the diagnosis of insulin resistance is not one that our physicians are being trained on.
Mhm.
And right now, there are so many people with insulin resistance who don't even know they have it, let alone prediabetes or diabetes. We know that cancers, heart attacks and strokes, dementia, kidney disease, liver disease are all related to insulin resistance. So if all of the major drivers of cost for payers and patients, the drivers of early morbidity or mortality, and all of the delayed healing and problems that happen on the surgical outcomes, if we can trace most of those back to insulin resistance or inflammation, we ought to be training our future healers to look for it, to recognize where it's coming from, to know how to measure it. And I'll give you an example. Right now, if you go get your blood drawn on your hemoglobin A1C, which is a 3-month measure marker of your glucose control, if you go measure that and it's 5.7, No one's going to argue with me if I say you have prediabetes. But if it's 5.6, almost all of my colleagues are going to tell me, why are you telling this person they need to do something different? It's normal. But I would submit to them that if you walk back the average glucose that's associated with an A1C of 5.6, it's not normal. If you look at their fasting glucose, it's not normal. And if those aren't normal, then why are we not diagnosing insulin resistance? You don't go from normal to abnormal just like this. It takes months, years, decades. So why are we not measuring A1Cs? And when it comes back at 5.3, saying, hey, you have some early signs that insulin resistance is in your future if you don't change something. Why are we saying it's normal? Because it's not. And this is kind of my stake in the ground is we need to be telling people it's not borderline. That's the dumbest thing that we can tell people. There's no borderline, okay? You're on a spectrum, and within that spectrum, you can float along it, whether it's with lifestyle and habits or with medication, you can move along it. So what is our goal? Our goal A1C should be much lower than we're telling people. We're blowing off millions of people who have abnormal A1Cs or insulin levels and saying you're normal and you're not. So that's what I would change is figuring out how to get that communicated across en masse to all the medical students.
Are you a fan of the GLP-1 products out there now that deal with A1C and the other things?
Yeah, great question. This is a tough thing because they are amazing drugs that work in a really specific way, right? What I'm not a fan of is putting people on them and not telling them that you're going to be on this for life because you haven't changed anything else.
Yeah.
That's really wrong, I think. And who benefits from that? Yes, the patient gets the immediate benefit, as far as the weight loss and the comorbidities that might be improved, their blood pressure, cholesterol, and so forth. But who's really making money on that? You follow the money trail, and that bugs me a lot. So, do we use them? Yes, but we're very honest with people about, listen, do you want to be on this for the rest of your life? Or do you want to do lifestyle? And when you convince me that you've maxed out lifestyle, that's when I would say, hey, we need to escalate this. But we don't do that over years. We make decisions based on 90-day increments. And that's where I think I'm fundamentally different with my colleagues on GLPs because most people aren't seeing their patients as often as I am and monitoring and trying to help them with the lifestyle change first. I get my colleagues tell me all the time, lifestyle doesn't work. We know it doesn't work. The studies don't show it work. And that's not entirely true. It does work when you have accountability and support. Our system isn't set up for that. And it's a system problem, not a people problem. So I do think GLPs have a role and they have made tremendous impact on some of my patients' lives. And I had a couple people who have looked me dead in the eye and said, Doc, I'm not going to do anything different. Just give me the medicine. I'll take it for life. And if that's their understanding, then I've given them an informed presentation of the information. That's all I can do. Just like your financial advisor, they'll tell you what they want you to invest in, but you get to decide, right? I'm just going to be honest and tell them what's going to happen and what trajectory this decision makes. And if they choose that, that's their choice. But I'm going to make a healthy, helpful decision option tree for them.
Dr. Amy, in anticipation of our discussion today, is there anything that I haven't asked you or we haven't touched on that you want to be sure and get in the program today?
I just want to make sure all of your listeners know that they can get a free copy of my book just by contacting our office. We ask them to pay shipping and handling, but we'll cover the cost of the book. My goal is to get that book into 1,000 moms' hands this year. So help me do that because this book is really designed to help moms who realize that now that they have a kid, what does life look like? How do I do the things I know I need to do and how do I do them well? So help me, help other people.
Okay, so help us. Tell us how we can get on your website and get that book.
Absolutely. VitalityMWC.org is our website, or they can just look up my name, Amy Loden, and Vitality. It'll pop up in Google. Just all they have to do is front page, contact us, say, please send me a copy of the book, drop your email in there. It'll come to me. I'll send you an email back and just say, where do you want this shipped? Very easy. We'll even send it in a pretty purple mailer that you'll love because everybody loves purple mailers in the mail. So it's fun.
Okay, great. At this point in the interview, I always ask my guests the same common question. And so that question is, in relation to leadership, what is
Mhm.
a pearl of wisdom that you could leave us with today?
So probably my favorite quote will play into this, which is don't let the best you've done so far be the standard for the rest of your life.
Wow, well said.
And I don't believe that we are created and put on this earth to just cap out and then not help other people. I think we're supposed to keep growing. We're supposed to keep being challenged. We're supposed to keep being uncomfortable and help other people do the same thing. And if we all say, well, I've met my best, I'm done, how boring would that be? How dysfunctional would our society be, right? It doesn't mean that that has to be your identity, but it does mean that that can be your challenge. Keep growing, keep moving forward, keep learning, fail forward.
Yeah. Lifelong learning. It's
Hmm.
so true, there, whether it's to become a leader or whatever you describe it, it's not like you get there at some point and say, "Oh, I'm there."
Hmm.
Continuous journey. There's always room
Right.
for improvement. There's always something you can do better and learn.
Uh-huh. Exactly. Well
Like,
said.
I agree with you wholeheartedly. Well, this has been a real pleasure. It sounds like you've really taken something you feel passionate about and made it happen and put it into a business and are getting that information to people, which we need more of that. And so I'm sure you feel the weight of the world on your shoulders sometimes because what you're doing is becoming more common, but it's certainly not common. So,
Right.
and I think we can all agree that that's a better approach to healthcare for sure. So.
Yes, absolutely. Well, thanks for having me. It's been a pleasure. And certainly, if your listeners want to follow us on all the social planner, can't talk platforms, it's at Dr. Amy Tiffany, and learn and grow with us, right? Challenge us, disagree with us. That's okay. Because when we do that, we make a better society for everybody.
Okay. Well, thanks again for your time. I know you're a busy person, so I appreciate it very much. And maybe we'll run into each other down the road one of these days.
Love it. Thank you so much.
Take care. Bye bye. Thank you for listening to another episode of Profiles in Leadership. To listen to all my interviews, subscribe to Profiles in Leadership with Steve Anderson on Apple Podcasts, iTunes, and many other popular podcast platforms. Some of these interviews are on video, and you can search YouTube for Profiles in Leadership with Steve Anderson. You can also access the entire library of interviews on my website, orange.coaching.com, and that is orangetheword.coaching.com, and go to the Media Center and click on Podcasts or Video Gallery. You can also enter the website from pilpodcast.com.